Yesterday, Madame Anglade was very critical of the health contribution tax proposal of Mr. Legault. She said it was a diversion, and then Gabriel Nadeau-Dubois said it's just a way to provoke non-vaccinated people, and it'll only help people like Éric Duhem and the Conservative Party. What is your position on this health contribution tax? Is it a good idea? Are you for it or are you against?
As we said, we're yet to see any evidence or public health memo that shows that there's a efficiency to that measure. So we're going to wait for the government to present the bill and to present what evidence or rationale there is in support of that bill. But it looks a lot like the curfew or the 20 people at the Christmas party on December 7th. Measures that seem to be very connected with polls that they're running on what is popular and what is not popular, and that is not supported by a public health opinion or a scientific evidence of any kind. Today we are meeting with two specialists, Kim Lavoie and Joanne Liu, and we are going to ask those questions because we are not afraid at the Parti Québécois to meet with experts and to give them the freedom to tell us what is the state of best practices and the state of science in that field. So that's what we're going to do, and we're going to wait for their bill, but we're yet to see any evidence.
Mr. Arsenault, do you want to add anything to that?
Well, I totally agree with Paul, obviously. All I can add is the fact that the government would like us to talk and talk and talk about this bill. We want to talk about getting out of the pandemic. And right now we have no evidence that this bill will help us get through. That's why we don't, make a splash and react in a very provocative way on this particular bill. We'll wait and see the bill for what it is. Right now, we've got other more important problems to solve.
Do you think it's Do you think it's a smokescreen,
Yeah.
a diversion, or?
Yeah, it definitely is a diversion. That's what we said when it came out, and we haven't changed our position.